Hello, hopefully everyone can see me. We'll get started in the next few minutes. We'll start sharply at 5 minutes after 12:30, 12:35 or so. Hopefully everybody out there is staying safe. Okay, well, thanks for joining. It's a trying time nowadays, to manage our lives in current settings. Pandemic's sort of messed everything up here, But it's the new norm, so we all have to sort of learn to live with it and go on. So we'll try to make this a very interactive and fun talk. We're going to talk about leg discomfort. It's the pandemic's also given us a sort of an opportunity to work on things that are important, relationships, things that we've forgotten over the years. Personal health. Before we used to say there's no time for me. Now there's plenty of time to take care of yourself. And there's really no excuse. Exercise, improving our lives, learning, which is what we're going to do today. Learn about leg discomfort and what we can do about it and what are the different causes. And we'll go over specifically vein disease and how it can affect us. So let's dive right in. And as I see the comments coming up, I'll stop and try to address the comments. Okay, so the painful leg conundrum. Anyone who's been exposed to modern era, modern life. At the end of the day, a lot of us have aching legs and pain because we've been sitting or standing for most of the day, and so we always wonder why are my legs aching. So the causes for leg pain can be categorized into broad categories like arterial disease, neurological condition, venous disease, arthritis, and musculoskeletal discomfort. So barring traumatic injuries to the leg, we're just going to focus on these pathological things that can cause leg discomfort. Arterial disease is more of a problem where the flow to the distal parts of the legs is lacking because of plaque buildup in the arteries. Arteries, as you recall, bring blood to the distal organs from the heart. And if there's blocked arteries or because of plaque, there's not enough blood flow into the muscle. The muscle needs constant blood flow, and as you walk, it needs a lot more blood flow. And if there's an impediment in the or obstruction in the blood flow, then the legs hurt. Neurological conditions like sciatic disc problems or herniated disc or impingement of a disc, that can cause leg discomfort. And musculoskeletal discomfort, like if you've had trauma or injuries to the leg. And then most common is venous disease, and that's what we're going to talk about today. Vein disease, now imagine the arteries bringing blood to the distal parts of the legs and the rest of the body. The veins bring back blood into the heart. So deoxygenated or blue blood comes back into the heart, and then the cycle starts again. So veins play a critical role in improving that, continuing that circulation. Just like the arteries can have problems with plaque buildup, the veins can be impacted not so much from plaque buildup, but from dysfunctional veins. And you know, we're in the modern era where most of us have a profession that requires us to stand or sit for long periods of time, whether you're a physician or a nurse or advanced care practitioner, non-healthcare related fields, you're a marketing person, you're an executive, you're an accountant, baker, whatever profession, we're constantly on our feet. And that's the that's the nature of who we are as human beings today. In the old days, where we used to be gatherers and farmers and hunters, there was a lot more physical activity, and in modern era there isn't. Sometimes we spend up to hour and a half commuting in large cities like New York. Sometimes you're on a subway for an hour and a half one way, which can contribute to poor circulation and poor health in the legs overall. So you're constantly exposed to gravitational pressure. Gravity is constantly playing a role in how it impacts our bodies. And so we're going to learn about why that plays an impact on vein disease. So going into the anatomy of the veins in the legs, there's multiple different veins that bring blood back up to the heart. And the central veins or deep veins are within the muscle structure, within the muscles themselves. So as the muscle contracts, the veins empty and improves the circulation. But the peripheral veins are closer to the skin surface, and there's not that much support structure for it to empty the veins. So the vein pressure builds up in the legs, which can cause all kinds of discomfort. So vein disease itself has been recognized as since the dawn of mankind, because it's stayed with us ever since we've learned how to march in an army. As you can imagine, these back in the day of ancient Greeks or Romans, where they have to march from one place to the other as an army, that constant gravitational pressure led to vein disease, and it was recognized very, very early. In fact, the first surgeries was actually documented by ancient Greek surgeons and physicians way back all the way up to 400 BC. In fact, there was a tablet found at the base of the Acropolis that actually documented a varicose vein. So it's a very old problem. It's been with us for a very, very long time, and it's been recognized for a very long time. And yet we fail to understand the impact of the problem because it's highly prevalent in our society. It's in fact more prevalent than heart disease, than arterial disease. For example, over 30 million Americans are affected by vein disease, and approximately 2 million people who seek treatment. And out of about 500,000 are treated for vein disease on an annual basis. So very common problem, much more common than heart disease, and it's easily recognizable. So in fact, you can probably look at your legs and recognize whether you have vein disease or not. If you see swelling in the legs, if you look at your legs, on the middle aspect of the leg, right down where the bony aspect of it is, mid-shaft and mid-calf level, you can press down, and if there's an indentation, that's swelling, that's fluid accumulation. If you generally, at the end of the day, when you've been on your feet a lot, you'll always notice a little bit of swelling or swelling when you press down on the bone. If you see discoloration, if you see bluish reticular veins, if you see large blue ropey veins, those are all signs of vein disease. If you start seeing the reticular or spider veins, you know that there's some venous pressure problem. So the very first thing you need to do is to, even before you seek help with a physician, just recognize the fact that, okay, there may be a problem. Ask yourself, is there someone at home who had this problem? Did my mom have this problem? Talk to your parents, talk to your siblings. And it typically runs in the family. If you have a profession that requires you to stand for long periods of time, well, then more than likely you'll have a higher venous pressure or venous pressure changes. So once you recognize it, and if you do have a profession where you're going to be on your feet most of the day, the first thing to do is to get a good pair of compression stockings. You can get over-the-counter compression stockings. Typically look for the millimeter of compression. 15 to 20 millimeters is a good starting point. Those are the non-prescription type. Prescription type run about 20 to 30. They're a little bit more sturdy. The more you pay, the better the quality you'll get. Typically they range from $15 to $20 for over-the-counter 15 to 20 millimeter compression to $40 to $160 for prescription brands. So get a good pair of compression stockings. Use it on the days that you're going to be on your feet a lot, especially for travel, because travel can cause significant problems, as you probably already have seen in your life. The main idea is to improve the venous return, and that's done by compression stockings, graduated compression, very tight at the ankles, and then it loosens up as it goes up. So second thing is using the calf as a pump. So the calf muscle is a very very active muscle. When we're using it, when we're moving, when we're walking, or when we're sitting in one place, typing on a computer, doing our work, or standing in one place, it doesn't work. So being conscious of that fact, you can do calf pump exercises to improve the venous flow and reduce the venous pressure. And if you do this long enough, the calf muscle gets strong enough and has enough tension where it can start improving venous pressure over time, especially for early disease, early parts of the disease process. So regular exercise, staying in good shape, using the calf pump, using the compression stockings, all will delay the inevitable gravitational pressures. And it is inevitable because unless your genetics are excellent or your profession doesn't require you to do all those things, the gravity will take its toll, especially if you're at risk. And as the symptoms get worse, people start noticing skin changes. The skin becomes thickened, rubbery, darkened, and sometimes even ulcers will develop. Obviously, don't wait that long. If you start noticing the skin is becoming rubbery, thickened, and discolored, that's the time to seek help from your friendly vein specialist or heart specialist or primary care doctor. All of these doctors can diagnose the problem. So we talked about what causes the discomfort, or what vein disease is. We talked about the reflux that causes higher venous pressure, how to recognize it, what are some simple things you can start doing, exercising, compression stockings, and then, but now we're going to talk more about how to deal with it now that you've had, let's say you have severe disease. So medical treatment for it is diagnosis is simple with visual inspection by a physician, that we can grade the type of disease you have, and then we can do a vein Doppler. There's many different types of vein Dopplers, and typically vein mapping is the best because we can actually measure each of the segments of the peripheral veins, and then measure the amount of reflux or regurgitation that's in the vein, and in order to understand what's causing the problem. So once you've diagnosed it, once the problem is recognized and you've already tried the simple things, and now you're seeking help, and the physician has said that, oh, you have vein reflux disease or venous claudication. The next steps, when you're more refractory to the conservative care, which is the walking, the compression stockings, and all those things, and then now you're starting to seek more advanced therapy, and that's where we can help. So medical therapy has failed at this point, and now you're seeking assistance from a more specialized vein doctor. And now we've already done the vein mapping, and we're looking at the cause of your symptoms. And now we recognize that there's parts of the peripheral veins called great saphenous, short saphenous, or perforator branches what are leaky. And we've already tried the conservative therapy, and you're still having a lot of leg discomfort. Next, we talk about some simple percutaneous procedures, meaning that we can easily access these veins with catheters with ultrasound guidance and redirect the flow to improve circulation in the legs. The whole idea is to improve your symptoms. If you have no symptoms, we don't need to go to this point. Even if the legs look darkened, ropey, the only real indication to pursue these types of surgical procedures is if you're starting to get severe symptoms, or if the legs are starting to get ulcers. Now, these ulcers are easy to recognize, and I can share some pictures of it on email if anyone's interested. And just leave a comment so we can help you out there. The ulcers are broken skin and discolored skin, and it just will not heal properly unless you seek proper compression and proper redirecting of the flow. And redirecting the flow, the purpose is to reduce symptoms, heal ulcers, and improve the circulation so it's not bogged down in the legs. The bogginess of the legs, the fluid as it accumulates, is just not properly moving, and it contributes to poor healing of the ulcers and the discomfort of the legs. So when I say redirecting the flow, what we're doing is we're looking at the diseased varicose refluxive vein, and we're introducing a catheter inside the vein with an ultrasound, and then we're numbing up the vein and with something called tumescence anesthesia. So it's it's in and out procedure. It's an ambulatory procedure. There's no sedation, just local anesthesia. Most of the time, it's not a typical surgery. It's a very relaxed setting. It's there's music playing in the background, and we're sort of working on your legs as we're numbing up the veins. And with the catheter inside, after we can see adequate numbing or tumescence anesthesia, we can turn on radio frequency or laser energy to close off the veins. And once the veins are closed, we can see it happening on ultrasound. We bring you back in 48 hours to see how effective it was. And then we work on improving the circulation by redirecting the flow. The body finds another way to redirect the flow to a healthy deeper system, which is close into the muscles. So the success rate for these procedures are very, very good, closer to 95 to 98% success at closing the veins, whether you're using a laser procedure or a radio frequency. Any of these procedures are very successful. Another method of closing these veins is a newer substance called a glue or VenoSeal. We use the same substance for people with aneurysms in the brain. Now we can use that in the veins to close off the veins. We're creating a controlled inflammation to close off the vein, whether it's with radio frequency or with glue or laser energy. At some point when these things aren't working, the veins aren't working, the body will start to close these things off on its own. And when it's doing that, that creates a localized phlebitis or inflammation, which creates a clot in the peripheral vein. And that clot in the peripheral vein doesn't travel, but it can cause a lot of pain. If you do notice some redness, achiness, or localized spots of redness, that may be a clot in your varicose vein. Obviously seek help, but simple measures like using a warm compress 3 times a day and occasionally using ibuprofen could reduce the inflammation. So we talked about the causes, the diagnosis, and the treatment. Simple percutaneous, minimally invasive procedures like laser vein ablation or radiofrequency vein ablation or glue. All these methods are to improve your circulation in the legs. Any questions so far? Okay, so as I said, it's a very safe procedure. It's done in the office percutaneously. So typically, it's not your typical surgery where you're asked to do bed rest for a couple of days and take it easy. No, this is not that type. You walk into the surgery suite, we do the procedure in our office, you walk out, and you make sure you're very active. Go shopping, go take care of your chores. Make sure you're very active. You're walking around, and that's the most important in avoiding the complication from the surgery. The complications are, there's about a 1% chance that a clot can occur or a deep vein thrombosis. That's why we bring you back for a 48-hour Doppler ultrasound of the legs to make sure there's no clot. And, infection rates are about 1%. Some people can get infection. Obviously, it's a sterile procedure. In our case, I think we've had 1 infection in over 3,000 cases. So very well tolerated procedure. Rare complications like cerebral nerve injury. There's a nerve that runs next to the lower leg below the knee. And if we're too close to the nerve, that nerve can get damaged. It can cause a localized area of numbness. That again is rare, less than 1% in our case, but that can occur as well. So it's a safe procedure. It's very effective in closing the veins. How effective is it in reducing discomfort and swelling? The discomfort called vein claudication generally disappears immediately as soon as we ablate. That's why I use the stockings as a method of figuring out whether you have vein reflux or whether you have symptoms from vein claudication. So stockings will relieve the pain, and the compression will cause less venous pressure. And if you have significant improvement in the stockings, then typically you're going to get a lot of improvement from the venous ablation. So safe, robust procedure. The ablation lasts for a very long time and relieves the symptoms of vein claudication. And if you have an ulcer, well, it's not going to heal until we deal with it with something like this. So that's it's really the best time to seek help if you're starting to see skin discoloration. Any questions? Comments? Okay, I guess if there isn't any comments or questions, we'll call it a day. Again, if anyone needs help or wants further information, we can give you an email of how to recognize vein disease on your own and when to seek help, some simple guidelines. And of course, we're always available here at Baptist to take care of your vein needs or any other needs. We're a complete heart and vascular center. The best in the city, best in the country. We have some top-notch, high-level professionals from vein disease to structural heart to electrophysiology to anything in between as far as heart and vascular. We also take care of a lot of complex arterial disease. That's where the plaque builds up in the legs, and we can help you with that too. So we're always here to help. Again, if there's no other questions, we'll call it a day and wish you all the best and always available to help if needed. Okay. I'll hang around for 5 minutes if there's questions.